So we wanted to establish PK parameters of Grapiprant in Rhesus Macaques, and we hypothesized that one, our data would show comparable plasma levels as to dogs with an estimated therapeutic threshold of 114 nanograms per milliliter, and two, there would be no significant sex differences in pharmacokinetics based on other PK studies of Grapiprant. So that was really the basis of our study.
Welcome to The Last Word, the official AALAS podcast dedicated to connecting and informing the laboratory animal science community. Each episode takes a closer look at recent articles published in our journals, JAALAS and LAS Pro, and features interviews with professionals advancing the field. I'm Jennifer Smith, your host. As a laboratory animal veterinarian and the Director of Education and Scientific Affairs at AALAS, I look forward to sharing these conversations with you. Let's discover something new together. Welcome. In this episode, I am joined by a new friend and fellow Michigander, Dr. Lauren Wierenga, DVM. And Lauren is currently the staff veterinarian at NortherBio. She received her veterinary degree at the University of Wisconsin and completed her lab animal residency training at Wisconsin National Primate Research Center. And Lauren is joining us today, and she is going to talk to us about her recent JAALAS paper titled Single Dose Pharmacokinetics of Grapiprant in Rhesus Macaques. Lauren, I am so glad you're here today.
Yeah, thank you. Oh my goodness.
My first fellow Michigan interview. So
woo, yeah.
We're best friends already.
Already, yep. Mm-hmm.
Already?
Yeah, I am so honored, Jennifer. Thank you for having me.
Awesome. Yeah, so tell us about yourself.
Yeah, I think you gave a pretty good intro of my current position. I am a clinical veterinarian at Northern Biomedical Research, which is a contract research organization in Michigan. But when I completed this project, I was a clinical veterinarian at the Primate Center in Wisconsin at the time. Yeah.
Nice. Well, that is a great background. And I mean, again, my bias from people from Michigan is pretty high. So,
right.
Yeah, no pressure, but of course.
Stick together.
Yeah, we got to stick together. Of course, this is going to be awesome. All right. Well, let us just jump right back into this. The paper is great. It's so exciting to talk about anesthesia, my favorite, but also to talk about some new agents. And I love it. I don't love the word Grapiprant because I don't say it very well, but I have a feeling this is an NSAID we're going to be talking a lot about in the future. So I'm super excited to jump into it. So tell us a little bit about how you got into lab animal medicine. Our listeners always want to know, they love the science, but they always want to know, especially for up-and-comers like you, how did you get into lab animal? How'd you find your way to the Primate Center? And then, of course, this current project, what made you want to take this on?
Yeah, great question. So I guess going way back, I was probably your typical little girl who wanted to be a small or large animal veterinarian growing up. But I really started to develop an interest in scientific and biomedical research in college. I attended Kalamazoo College in Michigan, which is just a small liberal arts school. But I had some really great opportunities to do some summer research projects at various institutions across the country, mostly working in the field of neuroscience with rodent models. When I graduated college, I knew I really loved science and wanted to be in the field, but hadn't quite decided on what direction I wanted to go at that point. So I took a job as a research assistant at the University of Wisconsin in the lab of Dr. Karen Downs, and she was studying mammalian development at the time. And I had a variety of, responsibilities in the lab, including managing a mouse colony, assisting with benchtop functions and grad students' projects. And that position is when I really started to interact with laboratory animal veterinarians and had the opportunity to learn more about what their careers were. So as I was, thinking about what I wanted to do ultimately, it kind of became clear that lab animal medicine was really a right fit for me, kind of joined those passions of mine of research and my love for animals. So I applied to vet school at UW and got in, and then I started molding my experiences in vet school to continue in the field. I was involved in some more neuroscience research after my first year in vet school over the summer. And then I decided to get a job at the Primate Center on campus as a veterinary student worker. And that was just really an amazing opportunity because, I got to learn firsthand from the vets and participate in a lot of their, daily functions and responsibilities. And that ultimately led to me doing a residency with them after graduation. So yeah, my residency landed kind of like right with the pandemic, which was a little unfortunate just because I think a lot of institutions experienced similar challenges of staffing and just keeping activities rolling. That did shape my trajectory a little bit with this project. I was quite busy clinically with activities, just being the resident, boots on the ground, when we were trying to, figure out how to stagger workers and all that good stuff. But it was a great experience in the end. And eventually I was hired on as a full-time clinical vet after completing my clinical and didactic portions of my residency. With that being said, though, my project was a little paused during that time. But then, as we kind of started to reemerge from the pandemic, things started slowly coming together, and I was able to formulate the final project. And I really became interested in this project because we had an aging population at the Primate Center. Some individuals had, chronic issues, especially osteoarthritis. And so we had to start thinking about new ways to manage that. We would see, some concerning changes in kidney and liver values. And we started to think about, new ideas to manage their condition. So that's when this project kind of came to fruition.
Oh, I love that. And thank you for sharing all of that with us. I love that.
Yeah.
Just hearing how organized you were about getting into this career path. And it's always so fun to hear how people get here. We're either, we either kind of reluctantly stumble into it, or like you're very organized and kind of made a very precise method to get.
It didn't feel like that always, I will say that.
Yeah. Well, and we all get here eventually, which is
exactly
fantastic. And I love that we're such a welcoming group, and I think we all just honor each other's collective experiences, and it just, it makes the industry better, it makes animal care better. And specifically,
Absolutely.
I love just you talk about this in the introduction too, just about why this project was important and, trying to solve this really problem. These guys need help. And,
we're all getting old.
Yeah, right? Yeah.
I feel the creaky joints myself. So I empathize.
Right. And just answering those questions of like, hey, how do we do this better? So, all right. So we're going to jump into the paper. But before that, introduce us to the team, because we know it takes a team to get a nice paper like this out the door. So tell us about the team, who did what, any juicy stories you want to tell us. We're all ears.
Okay. I guess there is a juicy tidbit I can share.
Okay. Yes.
Well, I'll start. So my team was great. I'll start with Dr. Casey Fitz. He is a staff veterinarian and surgeon at the Wisconsin National Primate Research Center. And he really mentored me through the initial steps of thinking about the project and logistics and details, and also assisted with the PK analysis. So he was key with helping with those aspects. Dr. Amita Kapoor is a scientist and head of the assay services at the WMPRC. She provided guidance, resources, and assistance in processing the samples, as well as performing the analysis of the samples. Dr. Ian Miller was our consulting data scientist, and he has extensive experience in pharmaceutical sciences. And he really helped me think through the best way to represent the data and run the statistics. And finally, we have Dr. Severio or Buddy Capuano, who is the attending veterinarian of the WNPRC. And he was just very supportive all around and provided, the oversight and guidance on the project. And everyone was involved in writing or editing the manuscript as well. And then I just wanted to shout out and recognize some of the hardworking veterinary technicians that helped with sample collection, as well as the care technicians. They, always pay good attention to the animals and care for them. And then, of course, the animals for their contribution to helping us. And then another special shout out to Dr. Jessica Johnston, who was really the pioneer in deciding to, take the first step in trying Grapiprant in one of her patients. So she gets credit too. But I guess the juicy tidbit I was going to share was Ian Miller, our consulting data scientist, and I kind of forced him into it. He's my spouse. So we were able to really sit down and work through some of the challenging problems, in the days where I really felt like I was like, oh, how do I think about this? And he really helps me with that. So I appreciate that.
That's outstanding. I love that. I love your transparency about that juicy tidbit.
Right.
I think that is fantastic. And, you're probably not the first person that has had their life partner on a paper. It makes perfect sense. And I think it's really great when the worlds collide like that. And
he's very good at what he does. Yes.
Yes. That's awesome. Thank you, Ian. Yeah. I'm glad that he was able to come into our crazy world, and we welcome him. And absolutely appreciate that contribution. Yeah. And so glad to get this paper to the finish line. So that is fantastic. Yeah. All right. So let's jump into the introduction. You got some really good information.
Yes.
And, I love to talk about anesthesia. I know others do too. And it was a great review. So I'd love to know, if you want to share some more for our listeners on just kind of NSAIDs in general and, kind of what the problem was. And then this new drug that we want to talk about. And then we always just kind of ask, what was the hypothesis, just so we can kind of follow along. So have at it.
Totally. Okay. So as a clinical veterinarian in the field, obviously pain management is a very large portion of our day-to-day responsibility in the care of our patients. And I rely significantly on NSAIDs for pain management in non-human primates. And really the proper choice of an NSAID is important, especially in an aging population. In my intro, I mentioned a survey that was conducted at the Primate Center, and more than 80% of animals develop spinal osteoarthritis by the age of 18. And with that, there can be obviously additional limitations with treating them in terms of their, ability to metabolize drugs and age-related factors such as reduced kidney and liver function. So really long-term NSAID use can be challenging in them. But NSAIDs are so important, and, they're indicated for musculoskeletal pain. We know we get a lot of traumas in our patients. Post-operative pain and inflammation. Like I said, the chronic use can come with some serious side effects. I can cover a little bit about just the basics of the NSAID role in cascade. So we're all probably somewhat familiar with the arachidonic cascade from vet school and kind of learning about that. So the arachidonic acid cascade is pretty important. We have our NSAIDs, which are mostly COX inhibiting. So they target that cyclooxygenase enzyme. About a decade ago, Grapiprant was kind of this new emerging drug in the Piprant class of NSAIDs. And what's special about it is it targets kind of a more downstream receptor in that whole arachidonic cascade. And so when we have side effects from NSAIDs, a lot of it's due to those off-target cyclooxygenase functions. A lot of the prostaglandins are involved in normal physiologic functions. So when we're targeting those, we're potentially causing our compromised mucosal membranes in our GI tract, in addition to other known complications. But here with Grapiprant, we have further downstream, when we have some prostaglandins produced, those prostaglandins then act certain receptors, and Grapiprant antagonizes one of those receptors, and that receptor is EP4. And that receptor has been shown to play kind of an important role in, bone inflammation, that kind of thing. So this drug is FDA approved for the treatment of osteoarthritis in dogs at 2 mg per kg. So we were interested in this because, with having that more downstream target, maybe we could avoid seeing some of the side effects in our patients as well, in our species. So we wanted to establish PK parameters of Grapiprant in Rhesus Macaques, and we hypothesized that, one, our data would show comparable plasma levels as to dogs with an estimated therapeutic threshold of 114 nanograms per milliliter, and two, there would be no significant sex differences in pharmacokinetics based on other PK studies of Grapiprant. So that was really the basis of our study.
Yeah, that's great. And thank you for laying that out so well, because some of this is new, even though that drug has been around a bit in our use, in our hands, is fairly new. So I love that review. It's time for a quick break to hear about the AALAS Learning Library. Hey, are you ready to elevate your team's knowledge and skills in laboratory animal science? Well, the AALAS Learning Library is your one-stop solution for comprehensive training. With courses designed for everyone, you can train your entire team in one place, earn valuable AALAS CEUs and RACE CE credits, and take advantage of group discounts to maximize that investment. Getting started is easy too. Sign up for free to access select courses instantly to explore a vast library of resources. Empower your team, stay ahead of the field, and grow with the AALAS Learning Library, your trusted resource for laboratory animal science professionals. Okay, so jumping into just kind of like, how do you even design a PK study for this? This is it's a big undertaking. So yes, we want to hear more.
Yeah. Okay. So, for anyone planning a PK study out there, I'll start by saying that there are some main decisions. Yeah, it can be challenging, but some of the main decisions to think about in study design include route of administration, single versus repeat dose, performing a dose escalation, determining the number of subjects, and planning a sampling schedule, using an analytical method, and then selecting your PK analysis approach. So that's a lot to think about, but you just take it stepwise. With no previously published PK data on Grapiprant and primates before, I tried to keep the scope pretty focused, mostly by prioritizing getting a robust initial data set in males and females that would allow for reasonable comparison with the canine data and factoring in the feasibility of the study timeline and resources available. I, followed the relatively straightforward PK study design with the baseline blood draw, followed by a single oral dose of the drug, and sampling time points at 15 minutes, 30 minutes, and then 1, 2, 4, 8, 12, 24, and 48 hours post-dose. I did elect to fast the animals late afternoon prior to dosing. And I wanted to do this because animals in a fasted state, compared like in other species, have shown better bioavailability with the drug. So I wanted to compare with those data sets. And then I elected to administer a dose of ondansetron as an antiemetic prior to sedation to help reduce the risk of emesis that may accompany fasting or following oral gavage. And then the morning of, I sedated the animals with our standard ketamine dexmedetomidine cocktail, and then reversed them with atipamezole after dosing in the initial first or second blood draw. So yeah, that's kind of just the basic overview of the study design. I didn't have anything particularly high-tech involved. I did make a point to find clear tubes for gavaging. Just some of those little minor details can really help. It made it easier to see that no excessive drug or residue was stuck in the tubing lumen after dosing and flushing. And, tried to test a variety of, methods and do dry runs of how the day would go for dosing and sampling, because once you're in it, you can't really stop, and it can be a lot of things to remember. So yeah, any residents out there planning to do a PK study, just think about those issues.
Yes, that's so interesting just to hear all of that, and that you are the second person that I've interviewed that did a primate PK study in the last little bit. And yes, there's so much crossover there, but yeah, just that organization piece. And and just having what you need. But I appreciate both of you just being so transparent about the process, because I think it's a big undertaking. And I think folks sometimes are like, well, no, I'm staying away from, those letters P and K. And I applaud you guys for taking this on. And also for knowing that, like, hey, let's get a mentor who has done a PK study that can help me bring it home. And I really, just that process, I think, is really great. And I'm so glad that, for all of you, that it came to fruition and you're able to share it and talk about it so eloquently. We appreciate that. You're definitely, you're moving the needle here. And that's really, really important because
it's all you can do.
It's all you can do. And the reality is we want to be confident about that drug we pull down off the shelf and that dose that we're giving. And, in the end of the day, we all want the same, we all want the same thing. And you're helping us get there. So I applaud you for taking that on. And I'm sure on those late
Thank you.
nights, it didn't feel that way, but
Yeah, right. Exactly.
right. Now that you're on the other side.
Yeah, it's much easier.
Yes, for
Talk
sure.
about it. Mm-hmm.
All right. Okay. So now that's awesome. So we've gotten through the study itself, the design. So let's jump into results. What did you find or didn't find?
Well, so initially I was actually pretty surprised by how low the maximal plasma concentrations were in macaques, leading us to reject our first hypothesis that they would at least reach, the estimated therapeutic concentration in dogs. That's pretty straightforward from the data, if you've had a chance to look at the paper. But the other surprising result to me was how much maximal plasma concentrations varied among our subjects, particularly in the female group, although ultimately we did not see any statistically significant differences in our PK parameters between males and females. In terms of, T max, the time it takes to reach maximal concentration, that was 2 hours in our study, which was a little longer than has been reported in some other species. And I can maybe discuss more about that in the discussion aspect. And then another somewhat interesting finding was that the half-life was actually a little longer than what had been reported in other species. So it was approximately 2 to 3 hours greater than the mean half-life reported in dogs receiving an oral dose. So, just some interesting findings on that front with various PK parameters.
Anything there that was surprising to you?
I mean, mostly the fact that I think the overall Cmax was as low as it was, honestly. Like looking across other species, it was pretty high, and I was expecting it to be at least, maybe 50 nanograms per liter, or, getting kind of more comparable to some of the larger species that it's been tested in. So the fact that we were seeing, mean Cmaxes of, I think it was 23.8 nanograms per milliliter was a little surprising to me when I initially got that data set back.
Yeah, I was a little bit surprised reading that as well and thinking, wow, that's, indeed interesting.
Yeah. Especially if you can take a look at some of the other papers, and it's kind of interesting comparison there.
All right. So how about in your discussion? What were some of the highlights there?
Yeah. So it's really, like getting back to that hypothesizing that plasma levels may be comparable in macaques based on previous anecdotal use. I will maybe preface this by saying, we had used Grapiprant at 2 mg per kg in some of our older patients. And I mentioned that in the paper just to kind of add some context. And we did take blood samples after one of their dosings just to kind of see, where they landed. And it was within expected limits based on our study results. But I guess in the context of that, just looking at reasons why this could be the case in macaques. So I feel like, there's a variety of issues to talk about, including a lot of limitations of the study. I can certainly jump into that. But one aspect was we elected to gavage a compounded liquid formulation, and that was mostly to ensure the most accurate oral dosing via syringe without risking animal noncompliance from voluntary consumption. Obviously, in an ideal PK study, you would want to have, an intravenous route to compare that to, because that gives you immediate maximal concentration and bioavailability. But given the fact that we were limited to the commercially available form, we had to take into consideration, how the oral dosing could ultimately affect the results in the end. And a lot of, the studies, it's obviously meant to be given orally. So considering, the way we design this might not be the most clinically, applicable situation, to giving this drug in the future. And that certainly should be explored, but hoping that in a fasted state, if we get it into the animal stomach, we're seeing plasma concentrations that are really not reaching what is estimated to be therapeutic in the end in other species. And that is to say, we don't have PD data or pharmacodynamic data to really assess the efficacy in our anecdotal evidence, we thought that use of this drug could be effective based on what we were seeing, on our day-to-day assessment of these older animals on Grapiprant. So whether, it is effective at lower plasma concentrations in macaques, that very well could be. We haven't been able to, it wasn't in the scope of the study to address that. And I'm hoping this will certainly lead to more studies to answer those questions.
Yeah, I think that is important. Okay, what else? Other things that were interesting and or, things that you guys identified as, other potential limitations?
Yeah, definitely. So the fact that, I did this under sedation so I could gavage the dose, that certainly could be a limitation to considering how this drug was absorbed ultimately. While I don't think ketamine at the dose we gave would have affected absorption that much, certainly an alpha-2 agonist like dexmedetomidine could potentially, affect the blood pressure, the blood flow to the GI tract, and could have affected some of the absorption of our drug to these animals. So, considering those variables, it could affect ultimately, the Cmax of a PK study. And that's something to, I think, consider when you're also designing a PK study. Getting back to your other question, I had given ondansetron, and I kind of looked into whether, this could have maybe affected anything with gastric or intestinal motility, as that has been debated. Ultimately, I can't rule out the potential physiologic effects of that, but certainly, co-administration of other drugs could always be a factor to consider, and maybe a limitation. There's always the question of sample size. In our study, I had 6 males and 6 females, and that is pretty typical for a PK study, but it is still a relatively small sample set. So being able to find ways to add additional groups and additional dose escalations among groups, that is, I think, something that could really be explored in the future as well. Yeah, I think I also want to maybe talk a little bit about the fact that we looked at how age played a role in, the overall absorption, distribution, and metabolism. And that's certainly something to think about when you're treating an older population. They may have alterations in their ability to metabolize drugs. And while our age group, it was a span of 3.9 to like 7.8 years old, we did want to see if there were any age effects. So we did compare our Cmaxes and other PK values to see if that positively correlated with age or negatively correlated with age. And our results did show that Cmax and total drug exposure, or the area under the curve in males, was positively correlated with age. But it's important to note that when you have multiple hypothesis testing, you do want to consider a potential false discovery rate and correct for that. So we did use a statistical method to try to correct for that and prevent any false positives. And so we used what we call a Benjamini-Ucatelli method. Ultimately, while that correlation was present, it could feasibly be explained by random chance. So we can't make any conclusions off of that for our study, but it's a pretty robust statistical method. And I certainly think looking into age as a factor that could affect PK parameters like this should be evaluated in the future, as that may lead to the need for dose adjustments in older populations and that kind of thing.
Yeah, I think that's really important. And I really,
Yeah.
I appreciate that you highlight that, because it's, while maybe a different population or subset,
Yeah. Yeah.
it could turn out to be the key population that is going to get this drug.
Right.
So yeah, I do think that's important. What
Right.
about your thoughts? I'm just curious on
Yeah.
using this as a sort of a multimodal, potentially
I
with other drugs.
I do think it could be a good option. It's concurrent use, with other NSAIDs. I haven't come across any literature that, says, I would probably caution against that, obviously. And
Sure,
maybe
sure.
even with steroids, just because it is downstream of the same effect. But I think as a tool in our toolbox, if that allows better pain control, it does seem to be a very safe drug. They have done studies in dogs up to 50 mg per kg chronically with very few adverse side effects. So I think it's worth considering that this could be a very good tool to have and drug to have in our repertoire of drugs for treatment and a multimodal pain management approach.
Yeah, I would agree. That's great.
Yeah.
Oh, I feel like we could talk about this all afternoon.
Yeah, and I certainly can get into more detail on certain aspects. I feel like there's many different things to talk about for sure.
No, you did a great job covering it, and we appreciate it. Okay, so we ask our authors one final question, and if you listen to the podcast, you probably know what this is.
I sure do. Yeah.
I'm not the most creative here.
No, it's great.
So we are asking you today, what advice would you give to somebody who says, hey, I want to take this on. I want to try this drug in my facility with this, NHP. What advice would you give someone?
Yeah, this is tricky. Considering our findings, I would definitely want some more data and questions answered before I could maybe reliably reach for this treatment option. However, like from clinician to clinician and speaking more from a personal experience, I would keep it as a consideration if other options have been exhausted or, may be more detrimental to the animal. As, like I mentioned earlier, there is some anecdotal evidence that this could be a safer and effective option based on personal experience and use. And obviously, this comes with the recommendation that, close patient monitoring is important, when you're dealing with new drug treatments and all that good stuff. And I certainly, I think in my last paragraph of my discussion, have some recommendations for maybe future explorations on, what we can look at for dose adjustments and testing higher doses of this drug for potential new studies and all that good stuff. But I wouldn't rule it out yet, even though we had some negative results or just, things that maybe were a little surprising. I think it still could be a good option in the future.
Oh, that's great. All right. Well, Lauren, thank you so much for being here. I loved chatting with you, my fellow Michigan friend. And you did a great job in this paper. And
thank you.
You're adding a lot to the body of literature here, and we really appreciate that. So thanks for being here.
Yeah.
And you guys, I'm sure this isn't the last we're going to see of Lauren. Hopefully she'll be doing some other good studies, passing them our way, and I can't wait to read them.
Yeah, thank you so much, Jennifer.
Thanks for joining us on this episode of The Last Word. We'd love to hear your thoughts, so be sure to leave your feedback in the comments. And don't forget to subscribe for more great content. We encourage you to submit your research manuscripts to our journals, JAALAS and LAS Pro. We're always looking to feature impactful studies. You can also connect with us on our social media channels or email us directly at info@aalas.org. We appreciate your listening today, and we'll see you next time on The Last Word, an AALAS podcast. Until then, stay curious and stay connected.